noisy?
Not very. It used to be very noisy, and again, some patients and some patients' spouses were so bothered by the noise that it became a real problem. The patient, some patients themselves couldn't sleep with the noise, and some spouses couldn't sleep with the noise, so it often resulted in the patient and the spouse sleeping in different bedrooms. But they're much quieter than they used to be and much better tolerated.
Before we run out of time, and we do that quickly, you know, could you tell our audience what other medical conditions can be caused by sleep apnea if it goes untreated?
Okay. We also need to mention oral appliances before we run out of time.
Go ahead.
Let me just mention that first. Another modality of treatment for sleep apnea is the use of oral appliances. And those are mouthpieces made by dentists that, in which the dentist take molds of the upper and lower teeth and then hooks the two molds together in such a way that the lower jaw is pushed forward like that, holding the airway open. Those are especially helpful in mild to moderate sleep apnea, not as helpful in severe sleep apnea, but they're helpful in mild cases, and some patients find them very well tolerated. Some patients tolerate that modality better than the CPAP, so it's something to consider. Those are made typically by dentists, and there are several dentists in Lynchburg that do make those. Let's get back to your other question. Was what
medical conditions?
What are the other
that
deleterious?
Are caused by this?
Yep, absolutely. What are the other deleterious effects of sleep apnea? Well, patients with sleep apnea have a very high rate of being hypertensive. And this is because repeatedly during the night when their oxygen levels drop, they're stimulated by their brains. Their central nervous system stimulates what's called the sympathetic nervous system. The pulse rate goes up, the blood pressure goes up, the blood vessels constrict in your body, and you get repeated, during these times of arousal, you get repeated stimulation of the system that creates hypertension and also strains the heart. Because of this and because of the repeated dropping of oxygen levels, patients have a significantly higher risk of getting coronary artery disease or the blockages in the heart arteries. Also a much higher risk of hypertension, and also a much higher risk of high blood pressure in the lung system, which is a separate problem unto itself. So people have estimated, it's hard to say exactly what the risks are because there's such a spectrum, but in patients with severe sleep apnea, life expectancy is probably decreased 10 to 20 years below normal because of the symptom complex that develops. So sleep apnea in its mild forms becomes sort of a joke with, oh, you know, my husband snores a lot. As it gets more and more severe, it gets to be a very risky proposition, and it's a life-threatening illness, not only as far as chronic conditions that develop, but also during the times during the night when patients' oxygen levels drop because of the stopping of breathing. The heart, not only is there a tremendous strain put on the heart, but as the oxygen levels drop, heart irregularities in heart rhythms develop, and there's an increased risk of sudden fatal heart rhythms. So it's one cause of sudden death during the night.
That's terrible.
So it is a very risky proposition.
You were going to tell us about sleep clinics. I'm trying to get in all the good
sleep
stuff.
Sleep clinics, yes. The way to officially diagnose sleep apnea is by having a sleep study or a polysomnogram. These are done at sleep clinics. Here in Lynchburg, we're fortunate to have Centra Health, which operates 2 sleep clinics, one at Virginia Baptist Hospital and one in Forest. During the sleep study, which takes place from, say, 9 at night until 5 or 6 in the morning, the patient is hooked up to a variety of devices, a heart monitor, an EEG monitor, which is basically a brainwave monitor that goes with wires on the head to monitor brain function and levels of sleep and levels of arousal. There's also a chest band to measure respiratory effort and a blood pressure cuff, and it's quite an interesting setup. And people in some cases are afraid that they won't be able to sleep at all during a sleep study, but that's not in fact true. You get used to it quite quickly. But during the night, the patient is observed, their level of sleep is observed, their vital signs are measured, and that's the way to officially diagnose sleep apnea.
Great. I thank you so much for coming and being on the show. I hope you've answered some questions that my audience may have about sleep apnea. Please come back. We will have you back. I hope you've enjoyed tonight's show. My next show will feature the media representative from LifeNet Health, the organ donation and procurement organization that covers the state of Virginia, and she's going to bring with her a heart transplant recipient. So that should be a very interesting show. Thank you so much for watching tonight. Have a wonderful evening. Good night.